Thank you everyone for joining today. This is the kickoff for our Maintain Your Brain series. So this is one of several events that happens between today and every Thursday from now until February 18th. So today we have Dr. Bandeira, and he's going to be talking about neuroplasticity and healthy brain function. Sorry, I'm just adding another folks in. And we are definitely excited about today's event. Thank you so much, Dr. Bandeira, for joining us today. I'm going to turn it over.
It is a pleasure. Welcome, everyone. Thank you so much for joining us today. Felicia, thank you especially for coordinating this. And I want to thank the Arlington as well for being such a forefront, just being a motivating factor, I would call it. Truly interested and caring for its residents and our community. So today's topic, it's actually my favorite. It's my favorite topic to talk about. I am passionate about this, and I hope that I convey that. So everyone can hear me okay? Fantastic. Okay,
Yes.
good. So just a brief intro. My name is Dr. Bandeira. I'm an internist and geriatrician. I'm double boarded. I currently, actually about 15 months ago, I went into private practice. I'm a concierge physician here in Naples. And prior to that, I served as medical director geriatrics at NCH Hospital. So I had an outpatient practice and inpatient, and I covered both hospitals until my tenure concluded, and I decided that I wanted to go out and practice medicine on my own. That being said, I still have my privileges at NCH, and we have a wonderful relationship between our practice and the hospital. That being said, I love being a geriatrician. I think that there's no more fulfilling subspecialty than geriatric medicine. When people ask me what I do, I tell them that I specialize in healthy aging. And to me, that is exactly what geriatric medicine is all about. Today's topic, neuroplasticity and healthy brain function. As I mentioned, it's my favorite. I also, in addition to talking to you about neuroplasticity during the time that we have, I also want to touch on where we are. Who is at the forefront right now regarding therapy, specifically potential therapeutic modalities. I also want to talk to you about aging, about also the increasing incidence or prevalence of pathologies like Alzheimer's dementia, which, as you all know, aging is a risk factor. So it's important to understand the pathology behind Alzheimer's and the inflammation that these plaques, these beta amyloid plaques and tau neurofibrillary tangles cause. And I want to conclude the presentation by showing you that more than any medication out there, neuroplasticity, I believe firmly, holds the key to healthy aging and healthy brain development. And not only neuroplasticity, but the important pillars of brain health, which are socially engaging activity, physically engaging activity, and cognitively engaging activity. And we're going to conclude at the very end, we're going to talk about the importance of these three, but also physical activity, why movement is so important, not only to whole body health, but specifically to brain health. So let's begin. I'm gonna advance this slide. There you go. Okay, so 2011, this year in our human history was monumental, like no other year. It's important to know this year because in 2011, the first of the baby boomers turned 65. And since, if we go to the next slide, since 2011, US baby boomers, 1 every 8 seconds has turned 65. That's 10,000 a day. That is 4 million a year. Now, jump ahead 10 years, we're talking 40 million that have turned 65 since 2011. And actually now this year, those that turned 65 just turned 75. And the wave behind them. Some authors have coined the term the silver tsunami. And I think that's a very appropriate term. Hold on a second. Okay. You know, if we advance to the following slide, why is this so important? I'll tell you why it's important, because as I put here, by 2030, which is not that far away, 9 years, we're going to have 71.5 million seniors in the U.S. And 1 in every 5 is going to be above the age of 65. And what I placed here at the bottom, for the first time in history, we're going to have more adults over the age of 65 than children under the age of 5. Human history. Right? And if we advance to the following slide, why is this so important? It's important because, look, I have a 4-year-old son. His name is Aiden. I'll show you a picture as we advance a little bit. Aiden is 4 years old, and when my son gets sick, my wife, who worked 14 years as a NICU nurse, says, hey, Joe, Aiden's not feeling well. What do? You know what I tell her? I tell her, take him to the pediatrician. Now, again, I'm an internist. I should be able to manage that, but I count and I depend on my son's pediatrician to look at him with the lens of a pediatrician. In the same way, individuals as they age, really there's no better lens than that of a geriatrician to view them. And I'll explain to you briefly why. But here's an article from US News that addressed specifically this. We had Heather Winston, Dr. Heather Winston, from Duke University. She said that our current health system is ill-equipped, and it really is, to provide optimal care for individuals above the age of 65. This silver tsunami, there's actually a shortage of geriatricians. If we were an audience right now, I would ask you all, anybody who's seen a geriatrician in the last, 5 years, raise your hand. And I'd probably maybe I'd get 2, maybe 3 hands going up in the audience. Why? Because there's a shortage, unfortunately. And but I remain optimistic. I believe that will change because there's a need. If we move on to the next slide, let me tell you why I am so passionate about geriatric medicine. Because geriatric medicine, actually, it focuses on these 3 pillars. It's really, if you notice on the top, it says quality of life and functional independence. That becomes gold. That's precedent. And in order to have that, these 3 pillars need to be fortified as much as possible: cognitive, physical, and emotional health. Human beings are, I was speaking with a gentleman this morning, human beings, we're not just a checklist of diagnoses. We're not. Maybe you can view a 25-year-old girl who comes into the office um, as nothing more than a checklist, and you can go through that visit in 8 to 11 minutes, which is the average. But you cannot do that, and you should not do that with someone who's 65, 75, 85, 95. You can't. Um, you have to take the time, and you have to look at not only those physical diagnoses, but you have to um, probe deeper into their cognitive health, their emotional health, and if again fortify those so that quality of life can be at the forefront and functional independence. We move to the next slide. A lot of this comes down to the brain. Okay? That 5.5 pound organ inside our craniums. And if we go to the next slide here, why does the brain become so important? Well, it becomes important because of this. I created this slide because I want you to understand how monumental this is. Look, today we have 47 million people with dementia. By 2050, again, not that far away, there's going to be 132 million. We're seeing the prevalence and incidence increasing. It turns out that of the different types of dementia, and there are a number of them, the predominant type is Alzheimer's, accounting for up to 82% of dementias. The healthcare costs are unprecedented. And on the bottom right there, I put that if dementia were a country, it'd be the world's 18th largest economy. And that is so very true. If we go to the next slide here, it's therapeutics, right? What can we do about it? Because right now, we do not have a single medication that has been shown to stop, cure, or revert the process of Alzheimer's. We don't. The most that any one medication can do is in a select small percentage of people, these medications may slow down the rate of cognitive decline. So I have people who ask me, look, that being said, is there room? Is there room for the medications we currently have available? I'm referring to the NMDA receptor antagonists, acetylcholinesterase inhibitors, medications like Aricept or Namenda. My answer to that is yes, on a trial basis. What do I mean by a trial basis? Well, what do we know about Alzheimer's? We know that when we do the cognitive screening tests, for instance, the Montreal Cognitive Assessment or the Folstein Mini Mental State Exam, we see that there's a 3-point drop every year that can be expected. So if you start somebody on a medication, the ones that we have available right now, which are for, and you start them on that medication, they're not having any adverse effects, you need to reevaluate that screening, right? Reevaluate that MMSE or the Montreal Cognitive Assessment every 6 months. If after a year they have not dropped the expected 3 points, and that suggests that, perhaps this medication is helping to slow down the rate of cognitive decline. But if you see that an individual is on any one of these 4 medications and they continue to decline, beyond those 3 points, then that's really evidence that the medication is not working. And then you remove it. I honestly, especially as a geriatrician, I believe that oftentimes less is more. There is too much polypharmacy. in our older population. And if somebody does not need a medication and does not benefit from it, then, and it can be removed, then yeah. In addition to being an internist and a geriatrician, I'm also a researcher. So I naturally am very data-based. I need to see evidence. And when we look at the clinical trials involving medications or therapeutic modalities for Alzheimer's, you can't help but feel discouraged. And I'm speaking to you honestly because, you know, we're not where we would like to be when it comes to therapy for such a devastating disease. We're just not yet, okay? But we're getting there. And why do I say that? Well, let's look at the forefront right now. Right? If we advance to the next slide, this next medication and the trials on became mainstream, and really it's based on monoclonal antibodies. And if you ask me, where is therapy for Alzheimer's and other types of dementia, where is it headed? It's headed right here to monoclonal antibodies that are specifically designed to target a substance or a protein. In the case of Alzheimer's, it's beta amyloid. Right? Now, this is based on the beta amyloid theory, and these are protein deposits that accumulate in the brains of some people, especially if they're genetically predisposed, and these proteins cause a disruption and in the communication networks of the brain, and they ultimately lead to formation of neurofibrillary tangles inside neurons that cause degeneration, and the neurons die. So what if we could target that beta amyloid? Well, I think the only way that we're going to be able to do that at some point is through monoclonal antibodies. Now, which ones specifically have come, to our attention in the media? If you'll advance to the next slide, Alicia. Just a quick recap what we just talked about: beta amyloid plaques, neurofibrillary tangles, tau tangles, right? And we're seeing an eventual neurodegeneration. And right here on the right image, you see a beta amyloid plaque. And there you see the neurons with the dendrites, the arms. Inside those dendrites are where we see the tau proteins, which are referred to as these neurofibrillary tangles. On the next slide, here it is. Aducanumab. Took me a while to pronounce that one, but this is an article that got a lot of publicity. It came out in Nature Journal back in 2016, and there was a lot of hype on this particular medication because the studies that were produced by the company Biogen, we're demonstrating a significant decrease in beta amyloid plaques. And if we advance to the next slide, here's the company. Now, always when I see a new medication, I look at the financial impact of the medication to see how the population and the market is responding to it. And I thought this was really interesting. In March of 2019, after all the hype that had begun in 2016, in 2019, Biogen announces that it was stopping development of the drug. And the reason behind that is that of the two large trials, the second one really failed. So the moment that happened, um, they had that one good phase 3 study, and the almost disaster of the second phase 3 study, Biogen's stock drops by 30 billion in market value. And then it wasn't until October 19th, Biogen again announces that it was submitting its potential monoclonal antibody for FDA approval. Again, the moment they do that, the stock, the market cap, jumped up by 15 billion. So it's interesting because when you look at Biogen's drug, and I was very excited about this. As I put here in the paragraph, Biogen reanalyzed the data from their futility analysis, and it led that that the study was a failure. But I put this in there: if you cut the data, the statistics in a certain way, it starts to appear that that second trial that was a failure actually wasn't that bad, and it begins to support the first trial. So you have Emerge and Engage. Those are the two trials that I'm referring to. Emerge was the promising one. If we go to the next slide, I'll talk to you a little bit more about that. Look, whenever there's a drug, and I really want to focus on this drug, because you're going to be hearing more of this over the next few months. Here are the two trials, Emerge and Engage. The primary endpoint of this study, that they wanted to show that the high dose group was, they had a significant improvement in their dementia scores versus the placebo. That was the primary endpoint. Now the Emerge trial actually achieved that. The Engage trial, which was almost identical, just simply it was a lesser dose. It didn't reach the primary endpoints. The secondary endpoints of the trials, again, the Emerge trial, yes, it received 5 stars, but the Engage trial did not. Why is this important? It's important because whenever a company submits a medication to the FDA for approval, the FDA requires 2 large studies to be performed. The FDA may make an exception if one of those studies, phase 3 clinical trial, is solid, it's good, and the second study didn't hit the mark, but it can be considered as supporting evidence. And that's what Biogen has done. How did they do that? If you look on the bottom paragraph, the futility analysis, they went back to it. They did an amendment to their protocol. And in summary, as I listed here, Biogen argues that if you only look at the patients who had more exposure to the highest dose, the Engage trial, which was the subpar, looks more like the Emerge trial. So there's a significant, there was a significant reanalysis of the data and a different presentation of the statistics. Now, they've been able to show that the endpoints are statistically significant. Now, look, I want you to understand, there's a difference between a drug being statistically significant and being clinically significant. I'll give you an example. If I provide you a medication that reduces your sneezing from 15 times a day to 14 times a day, that's statistically significant. But is it clinically significant? That's the question that we need to ask. We go to the next slide. Again, here's the financial breakdown of this medication. If aducanumab is ushered through by the FDA, it's going to be one of the highest grossing medications of all time. Currently, I've listed here the best-selling drugs that we have: Humira, Harvoni, and Lipitor. Those are the top three. I would not be surprised if aducanumab really takes number one position if it goes mainstream. If we go to the next slide. Again, I refuse to be negative. I have decided to be optimistic. Why do I say that? Exactly what I've listed here. If the drug does in fact work, this is going to be invaluable, right? Because why? We don't have any disease-modifying drugs right now. None. Those 4 medications that we currently have to help manage symptoms associated with dementia, remember, none of them stop, cure, or revert the process. The most they may do is slow down the rate of cognitive decline in some people. And those people are actually, I consider them to be very fortunate. So look here, even if Biogen's drug, right, even if there's only very modest benefits or improvements, we don't have any other drugs. So relatively speaking, it would be an enormous impact. And you know, the financial aspect of pharmaceuticals, it's motivational. It drives further research. So if this medication does get approved by the FDA and becomes available, it's really gonna, in my opinion, it's going to create more research. There's going to be more companies that are going to develop more effective therapeutic modalities. So if I sound negative on aducanumab, quite frankly speaking, it's because I have difficulty accepting the new data, because there is some these stats are not clear, and I think that there needs to be more objective data, more transparency in the new amendments in the new application to the FDA. But again, I stay positive. I see the enormous potential benefit that this medication could have. So it's right now it's a waiting game, especially over the next couple of months, to see where the FDA goes with this medication. If we go to the next slide. So for a moment, I want you to stop and now that we've talked about really the front runner of potential therapeutics for Alzheimer's, let's picture for a moment that, as disheartening as it may be to consider that, okay, the medication won't be approved. We're back to where we started. Okay, so what do we do? What can we do about it? And is there something that we can do to strengthen and fortify our brains? And I'm here to tell you that there is. Look, when we were little, remember being in science class, you know, we're all staring at this inanimate object, which is a brain, and wondering, you know, wow, that's inside here. If you go to the next slide, you know, fortunately, over time, we probably in a high school lab, we actually saw a real brain for the first time. And as we advance, the human brain, next slide. We've learned more and more about the brain. We know that the brain is electric, right? We are electric beings. If you go to the next slide, I try to convey that. We run on electricity. That's why we have a central nervous system. It's an electrical nervous system that focuses on impulses, right? And electricity. And that's what's being transmitted through neurons. On the next slide, you'll see here a very important monumental study. Look, this was a study done in Harvard, probably a little over 15 years ago, where they took a group of individuals, they split them in half, and they said, listen, this is what we're going to do. We're going to teach you all a one-handed piano sequence, and we're going to have you learn that sequence and practice it for 4 days for a specific set number of hours a day. And then before and after the trial, we're going to be scanning your brain to see what happened. Well, the rub was that one group actually got a real piano to practice on, and the other group was told to listen, to just place your hand on the table. You don't have a piano, you're just going to imagine that you're playing the keys for 4 days, set number of hours a day. Okay, so what did they find? If we go to the next slide, we see that the individuals that practiced the piano on a real keyboard, a specific area of their brain was activated. And we saw this on a modality called functional MRI, which actually lights up and it shows us exactly where the brain is being stimulated. And not only did the researchers see that this specific area was being stimulated that correlated with the fine motor movements, but that areas around that focus were being drawn in. In other words, that area of the brain was recruiting neuronal activity from the brain tissue around it and changing structurally. Okay, so then the researchers went to the individuals who simply had their hand on the table, yet they imagined that they were playing this sequence. What do you think they found? Surprisingly, when they did the functional MRI, they saw that the same exact area of the brain was being stimulated just by thinking about the sequence of finger movements. And not only was the same area of the brain being stimulated, but that recruitment of neuronal activity from the adjacent brain tissue to that area was happening in the same fashion. So what did that show the Harvard researchers? It showed two things. Number one, that the brain, whether you're actually performing the activity or imagining and focusing that you are, your brain doesn't know the difference. And the other key piece of information is that one area of the brain that's being exercised will recruit additional activity to it, to fortify brain enhancement, right? And this is really the foundation of neuroplasticity. The brain can actually restructure itself. And we can form bypasses in the brain, same way that you have a coronary that's clogged. We do a coronary artery bypass graft, and we bypass that area. And that is really the principle of cognitively stimulating activity and cognitive rehab. Go to the next slide. I mentioned to you that the Harvard researchers did functional MRI. How is that different than your traditional? Your traditional structural MRI, which is on the left, it allows you to see the brain tissue. Excellent image, but it doesn't show where heightened activity is happening. The functional MRI does. You see it right there in the middle, the two areas of brain that are being stimulated with secondary to a specific activity. Now, my favorite is actually the one on the right, the diffusion MRI. The diffusion MRI actually lets us see the pathways of communication, and that is a huge change from that initial brain that we were showed as kids, or the high school teacher holding a live human brain. Now, this is how our brains really are. If we go to the next slide. Why did I put this picture here? I put this picture because I want you to understand what are the neuronal pathways. In your brain, every time you perform an activity and intentionally, and that activity is repeated, um, the brain creates a pathway, just like this road. Now, as long as there's no damage, the pathway, that road, a car can handle a truck, it becomes very, 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 very commuted. If we go to the next slide, now what happens if there's an earthquake? There's an earthquake or there's a stroke. That pathway is damaged. Now, anyone who's suffered a stroke or whose loved one has suffered a stroke, and they're in the hospital, they're stabilized. What is the first thing that happens? Rehab, right? As soon as the patient is stable, they need to go to inpatient rehab for intensive physical therapy. Why is that done? Why is that done? Because the quicker you develop new pathways, the better. You probably have about a 6-month window when you're talking about a vascular stroke. So we're going from this crumbled road that you see here to the next slide, where the individual who previously lost movement in their left leg, now they're starting to gain sensation. They're starting to gain movement. And Felicia, if we advance to the next slide, you start to develop a pathway. And if you go to the next slide, that pathway becomes more defined. And here's what we ultimately want as we continue with physical therapy in that patient who had a stroke. The next slide will show that we want this. It may never be as good as the original road, but it's a pathway, and it'll get you somewhere. And that, in my opinion, is the principle of neuroplasticity and cognitive rehab. Next slide. So here's the imaging studies that I mentioned before that are my favorites. This changed the way I see the brain, right? Those pathways, whether it's on that road that suffered an earthquake, or the new road that you just saw on the preceding slide that's being built. These are pathways. These are pathways in the brain. Remember, we're electrical beings, so we need wires to conduct that electricity and messages within electricity. And this is how it is. We are simply a lot of wires. So advance to the next slide. I'll show you a couple more. I find truly beautiful, remarkable. Here's our brain. The next slide. There it is. There it is. Now do you understand how, as you're stimulating one area of the brain, whether it's that individual learning to play that one-handed piano sequence, or the individual who suffered a stroke and lost use of their left leg, and they're undergoing rehab, as you're stimulating that one area of the brain, the neuronal activity that's being pulled from the adjacent areas of the brain travels through these tracks. And that's how the brain can actually fortify that area. Next slide. This is my favorite, actually. Next slide. And if you take this image here, which is a side view of the brain, and you have the individual face forward, and you add more color, more graphics, this is what you get on the next slide. Right here. Next slide. There it is. That's the base of the brain. There you see the cerebellum, you see the pons, you see the branches of the cerebellum coming down. Next slide. There it is. That's an individual facing forward. So we really are wires up there, right? And these are our communication tracks. Now, let's keep going. Let's go to the next slide. Okay, remember I told you I was going to show you a picture of my son? This is Aiden. He was a little younger here. He's probably about 2 years old. He's 4 years old now. And you know, I'm always astounded by children. They are sponges, and they are limitless in their ability to learn. And that brain is developing so rapidly, right? The neuronal pathways are being formed continuously, even when they sleep. Even when they sleep, um, most most babies, actually most of a baby's sleep is in REM, right? Rapid eye movement. They're dreaming, and during the dreams are when these memories are being consolidated. The brain is actually highly active, just as active when they're asleep as when they're awake. If you advance to the next slide, now you know the misconceptions, and I put it there. The misconception is that okay, we're born into this world, our brains are developing at an unprecedented speed, and we approach infancy, we continue to develop our brains. In the next slide, you know, we hit a point that, you know, we hit adults, and suddenly that neuroplasticity stops. The brain stops, you know, restructuring itself. And whatever you got, you got. And, you know, you need to hold on to it because it's not going to get any better, right? That was our number one misconception. On the next slide, you know, here's our misconception number two. We thought that, okay, when you're not thinking about anything, your brain is at rest. But no, 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 no. Actually, when you're at rest, the brain is still highly, highly active. And we see that through functional MRIs. The next slide. Here's the other misconception, right? That you know, the brain finds silence, it finds lower activity when we're simply meditating, when we are sleeping, but it doesn't. Next slide. We go to the next slide. Keep going. Okay, so how do we learn? And this is very important. There's three things that need to happen for us to embed a particular memory, to create a pathway. The first way that we learn is chemically, right? Short-term memory, and that's primarily through neurotransmitters. Now, look, short-term memory, because it's chemical-based, it's quick, it's rapid. There is no structural change yet. It's kind of like juggling, learning to juggle. I don't know if anyone here has tried to juggle. You know, once you get the hang of it, by the end of the day, you know, it's just great. Try going back on day two, and suddenly you realize whatever you thought you had learned the previous day um, is not embedded yet. And why? Because that initial learning that you did was short term. It was chemical based, right? If you go to the next slide, I try to portray exactly that. Here's this young lady. She's learning to juggle. She thinks she finally got it down packed, and then on the next slide, she comes back the next day, and we see a very different scenario. So what happened? Well, there was chemical change, but there wasn't structural change yet. So what's the difference? Well, if we go to the next slide, you see here that that structural change comes along with long-term memory. It comes with repetitive actions that those individuals learning to play that one-handed piano sequence. It wasn't just one day. right? They were there for 4 days for a number of hours every day. Why was it set up that way? The study was set up that way because we knew that we couldn't just have chemical change in the brain. We needed to start to see some structural change, which takes longer. It takes more persistence. Um, that's why they say learning to play a musical instrument, if to master a musical instrument requires about 10,000 hours. Why? Why is that? Why? Because we need to have chemical and structural change happening. Now, look, oftentimes these happen at the same time. If we go to the next slide, I try to show exactly that. We have chemical short-term memory and we have structural long-term memory. And these oftentimes, they work together. So let me give you an example. Let's say we have an individual who's experiencing cognitive changes. So they are determined to train their brain. They're determined to stimulate the different areas of the brain, engage in cognitive rehab, engage the different areas of the brain, and allow neuroplasticity to have its effect. Okay. They start, and a weekend they feel discouraged. They're not doing well on their cognitive exercises, and they feel like giving up. When I've encountered that, I do my best to encourage them. And I say, look, do not quit. You cannot stop. You need to keep going, keep moving, keep stimulating your brain. Be patient with yourself and just keep moving forward, because there's a benefit. It's if there's a particular area of the brain that we know is damaged, we're going to try to fortify that, but at the same time, we have a lot of different areas that we can work with. And that is why people, need to engage, and they need to be persistent. There needs to be intentionality. On the next slide, so we learn chemically, we learn structurally, right? What do we know about individuals who can actually read Braille? Well, the area of the brain that is responsible for that fine sensation motor movement is more developed in these individuals. Blind individuals who read Braille, that area of the brain, there's actually an increased volume in that area of the brain. If you go to the next slide, let me give you another example. Left-handed individuals. What do we know about left-handed individuals? They're right brain dominant. And anybody who's right-handed, your left brain is dominant. If you're left-handed, right brain is dominant. My wife and my son Aiden are left-handed. What do we know about the right side of the brain in an individual that's a lefty? It's more developed. And the areas of the brain that handle the movement of writing. If we go to the next slide, there was an excellent study on London cab drivers. And we saw, and this is, mind you, this is before GPS, right? Before we could all just do Google Maps. London cab drivers, because of working years on the London streets, they had the map of London embedded in their brains. And if you looked at their brains, the specific area that handles direction was more developed than the general population. More developed and more volume. On the next slide. Okay, so what's the third way that we learn? We talked about short-term chemical. We talked about long-term memory structural change. And third, and this is what we're aiming for, is functionally. Our brain changes functionally. What does that mean? It means that once our brain undergoes that chemical short-term change and we persist in that activity, we have the structural changes. Ultimately, your brain becomes primed. It becomes primed in that it's more excitable and easier to use again. Let me give you an example. Somebody who paints, they're great with watercolors, Give them pastels. I guarantee you they'll make something beautiful. Why? Because their brain is primed. That area of the brain is more easily excitable. And that's the end result that we want when we stimulate our brains through repetitive activities. The next slide. Just as I was mentioning, that take an individual who paints watercolors, give them pastels. Watch what they do. And the next slide. Playing the piano. Remember I mentioned 10,000 hours? Hold on, but don't let that discourage you. If you want to learn to play an instrument, actually that's excellent cognitive exercise, because your brain is going to undergo those chemical, structural, and functional changes. On the next slide. Look, we originally had 6 different domains in our brain, neurocognitive domains. Fortunately, these have been narrowed down to 4 neurocognitive domains, and I've listed them here. And I've done it for a very good reason, because when you do a neurocognitive evaluation, you're looking at these different domains in the brain. On the top left, you see memory, right? And memory gets divided into immediate, short-term, and long-term memory. Executive function, which is the top right, that's like the C-suite in your brain, all the planning, problem solving, attention, concentration, judgment, reasoning, even emotions are there in the frontal lobe. The parietal lobe, actually up here, you have the visual spatial function. Sorry about the text there, but this is all navigating, orienting, driving. Okay, and on the 4th core neurocognitive domain is language. This is where reading and writing, word finding, speech. So take this diagram of the 4 neurocognitive domains and imagine that you're going to the gym and you want to fortify a particular area. Your brain is a muscle, right? You can see it as a muscle. Use it or lose it, and you can fortify it. If I want to exercise my biceps, I go to the gym and I do exercises specific for my biceps. I'll do curls, for instance. If I want to fortify my legs, then I do squats, for example. So in the same way, you can stimulate memory, you can stimulate and exercise executive function, you can exercise visual spatial function, and you can do it with language. And neuroplasticity supports that. Let me go on a little further to make this an everyday practicality. And I'm going to show you how. If we go to the next slide. Okay, driving. We've all, I'm sure, have had the experience that we're driving to work. We leave the house, next thing you know, we're at the office. And as we're parking the car, we think, how the heck did I get here? Right? Why? Why? Because as you were driving, your brain went into autopilot. It's less energy. Your brain goes into autopilot, and next thing you know, you're at the office, right? Because that routine became very, very monotonous for your brain. But if we go to the next slide, here we go. Driving. Look, driving is one of the most complex things that human beings do. I mean, think about it. You require all 4 core neurocognitive domains. You require memory. You require your executive function, which is planning and multitasking, right? Judgment. You require visual spatial function, right? Orientation, visual perception, navigating, and language. You need to read a stop sign, interpret a red light, a green light, an amber light. So driving can be actually a brain exercise. It can be an activity, but you need to make it intentional. How do you make it intentional? If you go to the next slide, I'll show you how. What if your driving experience intentionally became this? Suddenly, that's brain exercise right there. This is Tesla, by the way. This is their navigational system. And so you're seeing that bicyclist on the left. You're seeing the cars up ahead. You're seeing that there's 4 lanes, right? Actually, there's 5 lanes, 3 on the right, 2 on the left. 10th Avenue. Look at all the details, right? The cross section. If you intentionally engage in a simple drive to the supermarket and you view it like this, you are stimulating your brain. If you go to the next slide, chess. Anybody who plays chess, it's a remarkable game because, again, it's stimulating all 4 cognitive domains. And this is why, activity becomes so important, the reading, the writing, playing chess. It's important because, look, remember that the 4 squares? I believe on the next slide, I have that up again. When you're playing chess, you're using memory, right? Immediate, short term, and long term, which is where your skills are in. Executive function, you're using executive function in chess. Visual spatially, you're using it in chess. Language, if you're playing with an opponent, you're using language. That's why it's so important. So this is brain activity. This is brain exercise. If we go to the next slide, there are web-based tools out there that are available, and I've listed 3 of the ones that I think are up to par. My favorite is the one on the top, cognifit.com. Now, for some individuals, these websites may be difficult because they're not computer savvy, I think is the word. Right? They're not computer savvy, so it's hard to work with these websites. But if you can work with them, by all means, I think that they're a valuable asset. On the next slide, I wanted to show you all something very important. The gems of a healthy brain, right? We have cognitively engaging activity, right? Cognitively engaging. That's what we've been talking about, whether it's that driving experience, whether it's playing chess, whether it's playing a new instrument, whether it's painting or learning to juggle, cognitively engaging activity. But how about socially engaging activity? Why is social activity brain food? It really is brain food because we see that social activity engages several areas of the brain at the same time, a number of them, like almost not much else does. And if we advance to the next slides here, I just want to continue to pass through these slides. Let's go through the next slide and the next. So what I wanted to show you is the following slide here below this one. Okay, perfect. So remember the functional MRI? Okay, so is there a particular area of the brain that gets stimulated when there is social activity and interaction between humans, or even watching a video that shows people interacting? Yes. And we see that in this one particular study here, where the right side of the posterior superior temporal sulcus area of the brain was highly active, while an individual is watching an interactive video. Now, if the video was not interactive, that area of the brain did not light up on functional MRI. Now, why is it important for that area to light up with that interaction? Because it's enhanced. Remember, this goes back to the Harvard study where neuronal activity is being pulled from adjacent brain areas. That's why this is why one of the reasons why individuals that are quote unquote hermits, that they're the loner types. They don't like to interact. They'd rather be home and not engage with other people. Those individuals tend to develop cognitive impairments earlier on. Why is that? Because now you understand their brain is malnourished of that social activity, of that social stimulation. On the next slide. I keep bringing this up over and over again because it's important to learn that there needs to be a concept of intentionality. we've all been recommended to do crossword puzzles, right? Why? Why crossword puzzles? Well, look at this chart here. The four core neurocognitive domains. When you do a crossword puzzle, you're stimulating your language domain, you're stimulating your visual spatial domain, you're definitely stimulating memory, and you're stimulating executive function, attention to concentration, problem solving of a simple crossword puzzle. That's why crossword puzzles are recommended. I practice what I preach because in my spare time I'm doing my best to engage my brain. And every time I do an exercise such as these, I'm going back to this chart in my mind and I'm thinking, okay, what am I exercising here? Remember the trial that Harvard did with the piano keyboard and the other person that was simply had their hands resting on the table? They both had the same area of the brain affected, right? Stimulated, activated, and enhanced. But what if the person who had their hand on the table, instead of imagining that they were playing that piano sequence, what if they were thinking, I wonder what's for dinner? Do you think that they would get the same end result? They wouldn't, right? So there needs to be intentionality in everything we do. And this is why whether you're doing crossword puzzles or whether you're playing an instrument, driving, socially engaging, you need to think, okay, what am I stimulating? Intentionality. Next slide. Okay, so we talked about cognitively engaging activity. We talked about socially engaging activity. What's the third gem of a healthy brain? Physically engaging activity. If we go to the next slide, why is exercise so good for you? And I've been at lectures where I ask the audience, why is exercise good for you? And over time, it didn't take long to realize that, hold on, a lot of these answers that I'm getting are recurring. They're repetitive answers. They're the most common answers. So as you advance to the next slide, when I asked audiences, why is exercise good for you? These were the top responses. Good for your heart, circulates more blood to your brain. You reduce the endorphins, which are the feel-good hormones in your system. Keeps my joints moving, helps me stay healthy, and keeps me socially involved. I had one gentleman that told me that helps him to stay out of his wife's hair. I'll never forget that one. But these are the common responses. But if you go to the next slide, I want you to see that exercise comes down to your immune system. And when I say exercise, I mean movement. Right? If you go to advance to the next slide, your immune system, a large part of it is your lymphatic system. Right? This is the part of your body that fights infections. And that lymphatic system carries white blood cells, the warriors, the soldiers, your defense system. It carries these cells throughout your body. Well, how does it do that? Part of that lymphatic fluid carrying white blood cells requires contractions of skeletal muscles. So as you're walking, your skeletal muscles are contracting, and that lymphatic fluid is being swished throughout your body. So that's why, one of the main reasons why physical activity, physically engaging activity, is so important. If you go to the next slide, okay. You ever see kids? I think I'm fascinated by children because imagine these children right here, right? We have 5 kids, and they're sitting put. How long do you think? How many seconds are going to go by before they all start kicking their feet? Maybe 3, 5 seconds. And what do we do as adults? We yell at them. Say, stop kicking your feet. No. Look, this is evolutionary that they're kicking their feet. Why? Because they're moving their lymphatic fluid around. Why do you think kids are so healthy? Next slide. Here's another analogy that I want you to see. Look, we're mostly water. Our bodies are mostly water. We are at least 60% water. Our brain, 73% water. Our lungs, 83%. Skin, 64. Our muscles, 79. Look, even your bones are 31% water. Now take that concept, and if you go to the next slide, look at this beautiful waterfall, right? I would not hesitate to get underneath that waterfall and bathe in it and to drink from it because it's in movement, it's clean. It comes from a spring, right? This has every indication that it's clean water. Now, what would happen if somebody suddenly built a dam up on the top of that fall and just let that water sit? If you go to the next slide, this is what you would eventually get, right? You're not going to want to bathe in that. You sure as heck do not want to drink that. So look, if we are mostly water, how are we any different? This is why we need to always be in movement, right? Movement is life. Right? What's life? Someone would ask me, I say it's movement. What does a rock do? A rock? Absolutely nothing. It's static. It's not alive. Life requires movement. So let's go to the next slide. So this is what we want. We want movement. We want activity. We want socially engaging activity, physically engaging, and cognitively engaging. Let's go to the next slide. Nutrition. We are what we eat. This is one of my favorite pictures from Time magazine. Right? We are what we eat. It's true. What goes into your body is what will come out. If we go to the next slide, this is one of my favorites, right? By the way, if anyone wants to know, what's the best diet out there? What's the most brain healthy diet out there? One response, it's the Mediterranean diet. You have a moment, look up Mediterranean diet and the benefits of Mediterranean diet on brain health in particular. Let's go to the next slide. Okay. So what are some of the important nutrients that we need, that we know is important for brain health? We have omega-3 fatty acids, vitamin D, vitamin E, B12, antioxidants, turmeric because it's anti-inflammatory, right? There's the Mediterranean diet. Wine, that's a whole separate lecture, but we do see that individuals who consume 1 to 2 glasses of wine, not huge glasses, but regular glasses of wine, they have reduced incidence of dementia, and that's a whole lecture's worth. But we have data to support that. And now, look, if you don't drink, please do not start now. Okay, but if you drink moderately, conservatively, do not feel bad about it. Next slide. Okay. There's a concept called inflammaging, right? It's chronic inflammation in aging. Look, let me show you. Let me just depict this for you better. You see that hand on the top right? It's a child's hand, and an adult's hand to the left. Now, children, as I mentioned, they rarely get sick. They're practically made of rubber, right? And you rarely hear a child complaining of aches and pains. Now, how many of you and how many of us have joint pains? I can tell you right now, my right knee hurts. Why? Why? Because there is chronic inflammation associated with aging. And chronic inflammation is a risk factor for other diseases. If we go to the next, remember when I showed you that the beta amyloid plaques and neurofibrillary tangles that are associated with Alzheimer's. What do we know about the beta amyloid plaques in particular? They induce inflammation to the brain tissue surrounding it. There's inflammation from the beta amyloid plaques. So I'm just making my. And what do we learn from exercise or movement, skeletal muscle contractions, is that in an element called interleukin-6, which is a cytokine, is released when we exercise. Now, interleukin-6 used to be considered as pro-inflammatory. Even now, over the past year with COVID and coronavirus, we've repeatedly heard about the cytokine storm, right? And interleukin-6, basically inflammatory mediators that are rampant in the body in somebody who's infected with COVID. Well, here's the thing. In the early 2000s, we discovered that there's an interleukin-6 that's produced by muscle. And that interleukin-6, the same molecule, is actually anti-inflammatory. And that was a significant change. It was a paradigm shift, because if we go to the next slide, I'm showing you this because here, interleukin-6, right, that cytokine storm associated with COVID, we know that it's pro-inflammatory, yet at the same time, we're hearing that interleukin-6 in the muscle is anti-inflammatory. So how is that possible? Really, it's all relative. And if we go to the next slide, I explain why. Because during inflammation, that interleukin-6 is inflammatory during that systemic inflammation, right? But during exercise, it's actually anti-inflammatory because it's secreted by your muscle. How do we get that anti-inflammatory effect of interleukin-6? Well, we get it by moving. And that's why movement is so important for immunity. It's important because it circulates your lymphatic fluid throughout your body. And what's the other aspects? We know that interleukin-6 is produced from the muscle, and that interleukin-6 is anti-inflammatory. Let's go to the next slide. And here I don't want to get into medical jargon, but there is a mechanistic explanation as to why. But again, it's all relative, whether it's the interleukin-6 is coming from muscle or whether it's coming from every other area in your body during inflammation. Right? But we know that interleukin-6 from the muscle counteracts inflammation. Let's go to the next slide. So I know that this is quite a bit of information, and thank you for your patience as we work through the technicalities of the presentation. But I'd like to open up the floor for questions, and I will do my best to answer your questions.
You can unmute yourself if you would like to ask a question. You can also send it to me in the chat.
Okay, this is Mark Beeland, and I have a question about a very rare brain disease called CJD. I don't know if you're familiar with it, similar to mad cow disease. And
it's a prion.
Prion proteins. And don't know if there's any progress with treatments for that.
That I'm aware of, no significant progress yet. But again, I think if and when we do, the monoclonal antibodies are very likely to be the answer.
Thank you.
Great question, Mark.
It's a very good question. Another question. I love an audience with questions. I May not have all the answers, but if I don't know the answer, I will email it to you.
Okay. Well, if you have any questions, feel free to definitely check in and ask. In the meantime, where you're thinking of those, I want to let you know that we really thank the doctor to come on and explain all of this. This was really interesting. You know, I found it very interesting as well. I love the part about the piano, which is huge, and making sure you're stimulating your brain health no matter what age you are. So it's fantastic. Thank you so much. We do have a few events coming up as part of the series. So next Thursday on the 28th, we have 10 morning signs of Alzheimer's. Then on February 4th, we have Healthy Living for the Brain and Body. And on February 11th, we have Understanding Alzheimer's and Dementia. And on February 18th, we have a live webinar with Teepa Snow. Please feel free to email me if you have any questions. I know many of you have already signed up for that, so thank you so much. And if you would like to sign up for them, you can always make sure to reach out. You can go to our website, or it's also on our Facebook pages as well, where you can sign up for those too. Just going to check. I have one more. Just check if I have one more question, because we were streaming live on Facebook. And just check that feed.
I have a quick question, Felicia.
Yes.
Hi, my name's Craig Price, Dr. Bandeira. My dad and my mom are actually patients of yours. So we're big fans. And
your parents are beautiful people.
Oh,
Beautiful people,
thank you. Thank you. You've done a lot of good for them. So thank you so much for all your help.
You're more
I'm
than
fortunate. Oh, thank you. Well, they talk about you all the time. But I'm fortunate enough to be able to teach an improv class to the many of the residents there at the Arlington. And so we're doing physical activity. We're doing all the things that you were talking about in that social interaction, physical interaction, cognitive interaction. It's been fantastic to see those pathways get built in improv, and they get better and better every time we meet. But I was curious about the difference between a stroke and dementia and building those pathways. Is it more difficult to build those pathways or keep those pathways wide open when you're experiencing dementia rather than a stroke?
That's an excellent question. I'm more than happy to answer it. When there is a stroke, pathways are cut. Imagine it like that. There's an electrical wire, and you take an axe and you cut that electrical wire. At that point, the only hope is to be able to bypass that area, develop an alternate pathway as quickly as possible, right? So that's the abruptness of a stroke. People that have a stroke, they'll be talking to us. Next thing you know, drooping, and the arm is falling, and they don't even realize that their arm just dangled to their side. Right? So it's happening quickly. That cable is being cut quickly. Now, of course, it depends on what type of stroke. Is it an embolic? Is it a hemorrhagic stroke? It can happen a little more gradual, right? If there's a hemorrhagic stroke versus an embolic clot, right? A clot is probably the quickest one you're going to see, whereas a hemorrhage, it's not as quick, but still, it happens at a noticeable pace, right? Now, take that example and let's paint the picture of an individual who is beginning to have cognitive struggles because of Alzheimer's. Right? Now, what's going on in Alzheimer's in particular? Right? We're having protein. It's all about protein deposits. Right? We all have beta amyloid. We all have it in our brains. We all have beta amyloid, but our body gets rid of excess. There's not an accumulation. Some individuals, especially if there's a genetic predisposition, build up those proteins, those beta amyloid, and beta amyloid in and of itself, it's a very sticky molecule, and it forms these plaques, and this happens over time, right? And the neurofibrillary tangles are occurring as well, and over time we start to see these slow cognitive impairments appearing in different areas of the brain. And Alzheimer's happens to start in the hippocampus, in the short-term memory domain. But eventually we see, the frontal executive, domain being affected, the visual spatial, right? We start to see language becoming affected. Now, depending on where those protein deposits happen, whether it's beta amyloid plaques, and tau tangles in Alzheimer's, or whether it's synuclein protein in Lewy body dementia. It's proteins. Wherever those proteins are accumulating, that's where we see the neurocognitive impairments, deficits being created. So this is a long process, right? The process of Alzheimer's, usually when you observe it, it's about 8 to 10 years. Right, as we see the course of dementia from mild, moderate, into advanced, even beginning with mild cognitive impairments. So about 8 to 10 years. Now, what do we see? We see that the beta amyloid, it actually, the levels of beta amyloid begin to increase about 10 years before that. In other words, 10 years before we start to present with the clinical signs of mild cognitive impairment, right, or mild dementia, these plaques have been developing, right, which means that these plaques are beginning to interfere with neuronal pathways. So, comparing that to a stroke where we have a cut, this is a longer, Alzheimer's in particular, it's a longer process. So I believe that the good side of that is that, unlike a stroke where we have about 6 months to rebuild those pathways, for the optimal rebuilding, that we have that 6-month window. We can still have improvements after those 6 months, but they're not as drastic as the first 6 months. Okay. Now compare that with Alzheimer's, where we have 8 to 10 years. That, to me, I see an opportunity. I see more opportunities for those cognitively engaging activities that you just described, the physically and the socially engaging. Why? Because the brain is being continuously stimulated. Now look, we know that Alzheimer's, it's a chronic, progressive disease, right? And as of yet, we have nothing to stop it, cure it, or revert it. The most we can do is slow down the progress, the progression, right? The medications, select people will actually respond to them, and the progression of the Alzheimer's dementia will slow down. But I'll tell you what, look, there is no drug that can stimulate your brain like those activities that you just mentioned, or like the activities that we've been talking about, with the physically engaging, cognitively engaging, socially engaging activity. There's no substitute for those 3 gems of brain health. Right? So whereas some individuals may see stroke as the outcomes are so encouraging. Well, you know what? And the Alzheimer's, the outcomes are not encouraging. No, I beg to differ. I believe that the Alzheimer's dementia and the different dementias that we have, it is encouraging. We have time, but we need persistence, right? That's why I keep telling people, don't get discouraged. Keep going, keep moving. Come on, let's keep moving forward. There are some things that you're not going to be good at. Even us, all of us, right? There are certain things we stink at, and other things that we're naturally good at, right? So if you continue to stink at something you always did, it's okay, right? Let's focus on what you can do. Let's fortify the areas that are working well. And let's use that to motivate us, to drive us, to encourage us. Does that answer your question, Craig?
Yes, it does. Thank you. And thank you to the Arlington and Felicia for having this great presentation and keeping us going. Thank you.
Thank you. Felicia, again, thank you. And thank you to the Arlington. Thank you for the audience that has taken the time out of their day to log in and to participate. Really, I'm grateful. I'm grateful to you to all of you for the opportunity to share this time with you and to share, to educate, right? And Craig, it's great to finally meet you visually. I can see where you got it from.
Thank you so much. Thank you both for the kind words. We appreciate that, definitely. Now, Dr. Bandeira, if someone wants to get in touch with you, what's the best way for them to do that?
Simply call the office. The number here is 239-631-6780. Once again, it's 239-631-6780. Or you can also log on to our website. Website is www.premiermedconcierge.com. It was a website that I put it together with a lot of care, a lot of attention, a lot of love, and there are some beautiful testimonies in there that I think our audience would enjoy. But it's premiermedconcierge.com.
And sign up for his newsletter because it's very informative. I get it every week and I love all the information that I receive on there. Lots of jam-packed info on what's going on in the area, but then also that's pertaining to medicine as well. So thank you so much for attending today. And thank you, Dr. Bandeira, for all your information. If you need any information on the Arlington, we are a life plan community here in the Naples location. Our website is arlingtonnaples.org. Our number is 239-307-3000. And my name is Felicia Saracino. I'm the Director of Business Development. Thank you so much for coming today and for spending your afternoon with us. And thank you, Dr. Bandeira.
Thank you, Felicia, and thank you to our audience members. And I see some familiar faces in there. So yeah. It's wonderful to see you guys.
Oh, and one more thing, this is being recorded. We will have it up on our YouTube channel for the Arlington and then on our Facebook as well. And this way, if you want to go back and re-look at something, you can be able to do that. All right. Thank you again.
Thank you all. Have a wonderful, wonderful afternoon and a wonderful week.